It is a fact that it's becoming increasingly more dangerous to be a woman in America. More than 76% of adults in the United States, 194 million people, live with at least one chronic illness, and women experience chronic conditions at higher rates than men do. Heart disease, cancer, and stroke are the top leading causes of death for women nationwide. Now, medical advances have made it possible to manage and treat many of these conditions, preventing them from becoming fatal, but they still remain chronic. Now, women are being denied life-saving care simply because they're pregnant. And let's be clear, pregnancy does not reduce your medical risk, it generally increases it. Pre-existing conditions often worsen during pregnancy, requiring more medical attention, not less. So I want to tell you the story of C.G. Graham. She was a 34-year-old police officer and mother to a toddler living in North Carolina. Her story unfolds in a remarkable piece by Lizzie Presser and Kavita Surana for ProPublica. They report that when C.G. Graham was about 6 weeks pregnant with her second child, she went to the doctor complaining of chest pains and heart palpitations. Her heart was beating at 192 beats per minute. Just for context, normal resting heart rate is between 60 and 100 beats per minute. Graham said it felt like her heart was practically leaping out of her chest. She had a history of heart rhythm issues, and in the past, doctors had been able to restore her heartbeat using a shock procedure called cardioversion. But this was different. Because Graham was pregnant, instead of getting the treatment, she was sent home. She texted a friend from the appointment saying the doctor did not want to risk harming the pregnancy. Now, C.G. Graham was not seeking an abortion. She was simply seeking treatment for a dangerous heart condition. She was denied that treatment because of potential harm to her pregnancy. Just let that sit with you for a second. It's worth noting that ProPublica spoke with more than a dozen medical specialists who said the treatment she was seeking, cardioversion, is considered to be safe during pregnancy, and it should have been provided to her. But as ProPublica has also well documented, because their stuff is always well documented, in post-Roe America, and especially in states with strict anti-abortion laws on the books, doctors are fearful of running afoul of the law. Graham's family did give her doctor permission to speak with ProPublica, but they didn't reply to questions. When she could not get proper treatment for her heart condition, Graham decided that the only way to protect her health was then to terminate the pregnancy. Abortion is heavily restricted in North Carolina, but it's still legal up to 12 weeks. So C.G. Graham turned to the only abortion clinic in Greensboro, but there she faced new barriers. That clinic was overwhelmed with patients who had been traveling from surrounding states because, as you can see, most of the surrounding states have completely banned abortion after Roe was overturned. You can see them all in red. On top of that, a new state law now requires North Carolina patients to attend an additional appointment before receiving an abortion. Not for any medical reason, by the way, just because. Waiting periods and multiple appointment laws are pernicious but common anti-abortion measures whose only purpose is to make it more difficult for women to get health care. As a result, the clinic was backlogged, and Graham would have to wait another 2 weeks to be seen. Except Graham didn't have 2 weeks. Days after seeking medical care, Graham failed to show up to work. A fellow police officer and Graham's boyfriend found her unconscious, face down, in bed. Her 2-year-old son looked on from his crib as they performed CPR on his mother, but Graham was pronounced dead. Her family later told her son that his mother left Earth and went to be with the moon. He now calls the moon the mommy moon. ProPublica paints a harrowing picture of a family that was ripped apart, writing, quote, "For the past 2 years, every night before bed, Graham's son asks to go outside, even on the coldest winter evenings. He points to the moon in the dark sky and tells his mother that he loves her." All right, joining me is one of the authors of that ProPublica piece, the national reporter Lizzie Presser. In 2025, Lizzie, along with her ProPublica colleagues, were awarded the Pulitzer Prize for Public Service for a series titled Life of the Mother, which examined and investigated the unexamined and irreversible consequences of state abortion bans. Also with me is our great friend Michelle Goodwin, professor of constitutional law and global health policy at Georgetown Law. She's the host of the podcast On the Issues. She's the author of a very important book, Policing the Womb, Invisible Women, and the Criminalization of Motherhood. Welcome to both of you. Thank you for being with us. Lizzie, thank you for your remarkable reporting on this and the other reporting that you've done. You wrote, quote, "Each year, hundreds of thousands of women enter pregnancy with chronic conditions that put them at an elevated risk of long-term complications and, in some cases, death. For those who live in states that have banned abortion, their options are now severely limited," end quote. This is such an important point, Lizzie, that this has hit women. Many of us have said for years that abortion is health care. Reproductive care is health care. But you've put meat on those bones. This is people dying because they just need relatively routine medical treatment.
Yeah, it's exactly right. I mean, I think physicians warned us when Roe was overturned that we were already living in a country with the worst maternal health outcomes of any developed nation, and that these abortion bans were only going to make that worse. And I think that that's what we see in the case of C.G. Graham. What she needed was standard cardiovascular care. But you can also see that in recent surveys, less than 30% of the cardiology workforce has gotten formal training on caring for pregnant women. And we hear from OBGYNs across the country that cardiologists are generally nervous and unsure how to treat pregnant women. And then you layer on top of that the fear and confusion of these bans, and you create even longer delays to care. C.G. Graham did not have 2 weeks to get an abortion. She did not have 3 weeks to get a cardioversion. She had 5 days, and she could not get the care that she needed.
And didn't need the abortion in the first place, didn't want the abortion in the first place if she had gotten the treatment that she wanted. I mean, Michelle, I don't know how many times you have said this to me. It sticks with me all the time. There's zero reason why America should have the maternal health outcomes that it has. There are countries that you have named to me, Michelle, that you would not think had better maternal health care outcomes than America has. This is a lot of BS.
That's right. We rank somewhere around 55th in the world, so well beyond our peer nations and economically comparative nations. I mean, we're behind Saudi Arabia, Bosnia, countries that have been involved in genocide, war-torn, et cetera. And even leading up to the Dobbs decision, Texas, for example, was considered the deadliest place for a woman to be pregnant in all of the developed world. It's really horrific what we see coming out of Dobbs. We knew it coming into Dobbs just a few years before that decision in a case called Whole Women's Health v. Hellerstedt. It was a decision that was authored by Justice Breyer. And he took note of studies. And one of those studies, and it's been affirmed by numerous others, that a woman is 14 times more likely to die carrying a pregnancy to term in the United States than by having an abortion. Now, that was a 5-3 decision upholding Roe v. Wade. And it's horrific what's taken shape in the space of Dobbs. So we have criminalization, we have women dying, we have women being tethered to machines as brain death. It is really a horrific landscape. And we're here only for political posturing. It's not about health and safety.
Right. There's no need for it. Lizzie, in your remarkable reporting, you say that because of Graham's heart condition, the abortion clinic she went to told ProPublica that she would have to ultimately receive abortion care in a hospital setting. But the reason Graham went to this abortion clinic in the first place is because the hospital doctors turned her away. I mean, this is the complexity of it, that people are being turned away from the obvious thing you're supposed to do, right? From the time we're little children, you understand that you call an ambulance, it takes you to the hospital, they treat you, and you go home.
Yeah, I mean, I think one of the things that's really disturbing in her medical records is that neither of the cardiologists that Graham saw spoke to her about her pregnancy and the risks of continuing it without getting the heart care that she needed, this shock to her heart, this cardioversion. And that silence around pregnancy and its risks, that's being normalized by these bans. And that is deeply, deeply concerning. And so then you have a woman who believes she can't get this care, who doesn't quite understand the risks of staying pregnant, and who goes to an abortion clinic where you think you can get the care to get unpregnant, to get the heart care that you need. But these abortion clinics are just not set up and have never been set up to triage medically complicated cases. They're not emergency rooms. And so they aren't prepared to say to a woman like CG, you need to go to a hospital until they walk into that clinic door. And that was going to be 2 weeks later, 2 weeks that she did not have.
Michelle, one argument that the anti-abortion movement has made for banning abortion pills is that the pills pose health risks to pregnant women. But it strikes me that it's far more dangerous in the case of CG to have been pregnant at this point. She had done the math that she didn't want to have to do in her head, that the medical system should be doing for her, but she did the math and said, I'm going to have to terminate this pregnancy, not what I wanted to do. This is the complexity about this. We're closing off all avenues to women being able to make decisions for themselves.
That's right. And we're not paying attention to real health and science. We've known for decades that abortion medications are incredibly safe as a penicillin shot. The WHO has long asserted, and we know even with mifepristone, misoprostol, through various studies, they're incredibly safe, safer than Tylenol and so much more. But what we see is a tragedy in these states, as not only do these bans mean a closing of clinics that would otherwise provide contraceptive care, abortion care, prenatal care, postnatal care, but it's also hypocrisy and a tragedy because these states are not opening more clinics that would provide the kinds of health care that people need nearby. And so we have these healthcare deserts. We have these reproductive healthcare deserts throughout the United States. And we see the kind of suffering that's being reported, and then so much more that doesn't end up getting reported, that just simply gets lost in the mix of things. And that's the real tragedy.
So I just want to put some meat on those bones, because we've made the comparisons and we've got the shock and outrage that America is at this place in terms of maternal health care. But Lizzie, the most recent CDC reports that the CDC data reports that 669 women died of maternal causes in 23. That is 2 to 3 times higher than most other developed countries as a proportion. This is real. To Michelle's point, this isn't, your story is remarkable. Your story is the story of one person. This kind of thing is much more common than people will acknowledge.
I think the other piece of it is some of these laws are called, the life of the mother laws, right? Where they're saying that there are opportunities to intervene to save the life of the mother under these abortion bans. But that generally means, it's interpreted by doctors to mean that a woman has to be risking imminent death, nearing death almost immediately to intervene. And there are so many women like CG out there who are dealing with slow moving emergencies. Mm-hmm. They're not about to die. They are facing risks to their long-term health and small risk of death. And the state is now gambling with their lives. They're saying you don't get the option to have a health exception. You're only able to get care if you are facing an imminent risk to your life. And we see how that plays out in CG's case. She needed health care. She needed abortion, or she needed a cardioversion for her heart in order to survive. And there is no exception in these laws for the health of the mother.